Why seniors suddenly lose their balance while walking, the hidden warning signs you should never ignore. Have you ever been walking normally and suddenly felt unsteady? Maybe you felt like the ground shifted beneath your feet. Maybe you stumbled for no obvious reason. Or perhaps you've noticed that your balance isn't what it used to be. Many older adults assume this is simply a normal part of aging. But what if it isn't? What if your body is actually trying to warn you about something important? Today, we're going to explore why seniors suddenly lose their balance while walking, the hidden causes that many people overlook, and the warning signs that should never be ignored. And be sure to stay until the end, because one of the most common causes of balance problems is something millions of older adults experience every day without realizing its impact. Let's begin. Most people believe balance comes from their legs. But in reality, balance depends on three major systems working together. First, your eyes. Your vision helps your brain understand where your body is in space. Second, your inner ear. Deep inside the ear is a system called the vestibular system, which constantly detects movement and position. Third, your muscles and nerves. Sensors in your feet, ankles, and legs send information to your brain about the ground beneath you. When all three systems work together properly, walking feels effortless. But when one system starts to weaken, balance can become unstable. As we age, changes can occur in all three systems. That's why balance problems become more common after age 60. However, sudden balance problems should never be dismissed as just getting older. Hidden cause number 1, vision changes. Your eyes provide critical information for balance. Unfortunately, vision often changes with age. Conditions such as cataracts, glaucoma, and macular degeneration can reduce the quality of visual information reaching the brain. Even mild changes in vision can make walking less stable. Research has shown that older adults with poor vision have a significantly higher risk of falls. Warning signs include difficulty seeing steps, trouble walking in dim light, feeling less stable in unfamiliar places, increased stumbling. Regular eye examinations can help identify problems before they become serious. Hidden cause number 2, weak leg muscles. One of the most overlooked causes of balance problems is muscle loss. After age 50, adults naturally begin losing muscle mass. This process, known as sarcopenia, can accelerate with inactivity. Strong leg muscles help stabilize the body with every step. When these muscles weaken, even small obstacles can cause instability. You may notice difficulty rising from a chair, slower walking speed, trouble climbing stairs, fatigue after short walks. Strength training has been shown to improve balance and reduce fall risk in older adults. Even simple exercises performed consistently can make a difference. Hidden cause number 3, nerve damage in the feet. Many seniors experience numbness or tingling in their feet. Often, they ignore it. However, reduced sensation can seriously affect balance. Your feet constantly send information to your brain about pressure, movement, and surface conditions. If those signals become weak or distorted, your brain receives incomplete information. This condition is commonly associated with diabetes, vitamin B12 deficiency, peripheral neuropathy, certain medications. Many people don't realize they have nerve damage until balance problems begin to appear. If you frequently feel numbness, burning sensations, or tingling in your feet, it's worth discussing with a healthcare professional. Hidden cause number 4, inner ear problems. The inner ear plays a crucial role in balance. When it isn't functioning properly, the brain receives conflicting information. This can create sensations of dizziness, spinning, or unsteadiness. One common condition is called benign paroxysmal positional vertigo, or BPPV. Although the name sounds complicated, it simply means that tiny crystals inside the inner ear have moved out of place. Symptoms may include sudden dizziness, balance difficulties, feeling unstable when turning your head, vertigo when getting out of bed. Many cases can be treated successfully once properly diagnosed. Hidden cause number 5, medication side effects. This cause surprises many seniors. Certain medications can affect balance. Common examples include blood pressure medications, sleeping pills, anti-anxiety medications, some antidepressants. These medications may cause dizziness, drowsiness, slower reaction times, lightheadedness. The risk becomes even higher when multiple medications are taken together. Never stop medications without medical guidance. However, discussing side effects with your healthcare provider may help identify possible contributors. Hidden cause number 6, low blood pressure when standing. Have you ever stood up and suddenly felt dizzy? This may be a condition known as orthostatic hypotension. When you stand, gravity causes blood to move towards your legs. Normally, the body quickly adjusts. But in some older adults, the adjustment is slower. As a result, the brain briefly receives less blood flow. This can cause dizziness, blurred vision, weakness, sudden imbalance. Symptoms often last only a few seconds but can increase the risk of falls. Staying hydrated and standing up slowly may help reduce episodes. Warning signs you should never ignore. Occasional imbalance can happen to anyone, but certain symptoms require attention. These include sudden worsening of balance, frequent falls, new weakness on one side of the body, difficulty speaking, sudden vision changes, persistent dizziness. These symptoms could indicate a more serious condition and should not be ignored. What you can do starting today. The good news is that many balance problems can improve. Simple strategies include staying physically active, strengthening leg muscles, having regular vision exams, reviewing medications, wearing supportive footwear, managing chronic conditions such as diabetes. Even small improvements in balance can significantly reduce fall risk. Remember, falls are not an inevitable part of aging. Many are preventable. Losing balance while walking is not always just getting older. Sometimes it is your body's way of telling you that something needs attention. Your eyes, muscles, nerves, inner ear, medications, and circulation all play important roles in keeping you steady. The sooner problems are identified, the more options you may have to improve your stability and maintain your independence. If you've noticed balance problems recently, don't ignore them. Your body may be trying to tell you something important. And if you found this video helpful, consider subscribing for more evidence-based health information designed specifically for adults over 60. Thank you for watching, and we'll see you in the next video. Be sure to subscribe to this channel. I'm your health partner.